Good morning, everyone. Thank you so much for tuning in today here at Facebook Live with the County of Santa Clara. Today is Friday, October 23rd, and today we continue to do our segments for Binational Health Week. I'm going to be removing my face covering so that way our ASL interpreters understand what I'm saying, and so you can also better understand what I'm saying today. Today we have our guest, Carmen Garcia, who is an outreach specialist from the California Telephone Program. And today we'll be talking about the California Telephone Access Program, also known as CTAP. But before we get started, we want to give you an update in the number of cases that we have here in Santa Clara County with COVID-19. As you can see, there are appearing under our screen right now, so you can go ahead and take a look at where we are as in yesterday. Our numbers for today will be updated around 2 o'clock, and please visit our website to check out our dashboards as well. So as we were talking, we continue to do this segment on Fridays for Binational Health Week. Binational Health Week happens every month, every October, and it's a month-long series of events to bring services to our community here in Santa Clara County, especially to our Latinx community. And we're talking about any services such as healthcare, access to healthcare, testing, especially around COVID-19 testing, flu shots, and other health screenings. And all of these efforts are thanks to our community partners, volunteers, and other federal agencies. So let's go ahead and get started with the segment. So thank you for accepting our invitation to share important information with our community, Carmen. Carmen is from the California Telephone Access Program and will tell us about this program's office, the resources available, and as well as how our community can benefit from their services. Good morning, Carmen.
Good morning, Ricardo, and thank you so much for having me. I've been looking forward to this interview with you.
Amazing. Thank you for being here. Tell us more about what is the California Telephone Access Program, or also known as CTAP, and what are some of the main services that your program offers?
So CTAP, for short, is a state-funded program. We're actually part of the Public Utilities Commission, and we provide free specialized telephones for people that have a hard time using a standard telephone.
Awesome. So talk to us about the importance of being a partner during Binational Health Week, and especially right now during COVID-19.
Well, like I said, thank you so much for having us on, because our position of outreach specialist is to be out there to let the community know about the program and the amazing services that we have. But because of COVID, we're not able to be out there in person. And this Facebook Live opportunity is exactly what we need to continue to be able to do the outreach.
Yes, no, thank you so much for accepting our invitation. As many of you know, we have been trying to work with our community partners and also provide an opportunity for them to bring those services to you via our Facebook Lives here at the county. So Carmen, can you please talk to us about how has COVID-19 impacted your services, and are you still providing services? And if so, how is it different than before?
Sure. So in regards to my position, again, I'm not able to be out there in person. So we are providing online presentations about the program, and those have been tremendously helpful. And then also in regards to the program in general, we have never closed because we are an essential service provider. So our offices have maintained open. However, we do have quite a bit of safety measures in place. So for example, we only allow 2 customers at a time, so that they can ensure that they're going to be safe when they come in. We've got the shields in place, the masks in place. And then also we do have what we call field advisors, and those are our colleagues that go out into the homes when someone needs assistance, maybe setting up their telephone or programming it once they get it. Again, we go out into the homes to help with that, but because of COVID, we haven't been able to do that because we want to keep everybody safe. Most recently, what we started to do was going back to those visits but on a very limited basis and only for those most vulnerable customers. So again, we want to make sure that they are able to stay connected using their telephones, and that is why we've gradually are allowing those home visits again.
Wonderful. You guys are doing a lot of work, and I know it does take a lot to adapt to a new normal, and I'm glad that we continue and you're also continuing to provide services to our community, especially with the work that you do, providing devices to people to better have access to healthcare, to their doctors, and to meet their needs. Now, earlier you mentioned that the program is funded through the state. Can you talk a little bit about how the program is funded and if there are any income restrictions or age restrictions and who can apply?
Definitely. So yes, we're a state-funded program, and the funds come from you and I and anybody else that pays a phone bill. So if you look at your phone bill next time you get it, there's several surcharges that are listed on there. And the one that funds our program in particular is the California Relay Service and Telecommunication Devices Fund. So if you look at it, you'll notice that there's 3, 4, 5 cents that are contributed to our program, so that if and when you need one of our specialized phones, they're available to you. And in regards to the requirements, we are fortunate that for this particular state program, there are no age or income requirements. You probably know of children or young adults that have mobility or hearing problems. So for that reason, there are no age requirements.
Great. And is there an income requirement?
No income requirement either. The only requirements are that you live in California, and that's because Californians fund the program. You have to have telephone service established already, whether it's the landline or the cell phone, and then your doctor does have to complete an application.
Wonderful, wonderful. Thank you so much for that information. So what is CTAP's primary purpose or goal?
Our goal is to ensure that everybody can stay connected, especially during this pandemic. I think we've all recognized that our telephones are a lot more important, right? That's what we're relying on, since we can't go out and visit family, or we prefer to do everything over the phone as much as possible. And so if you have a hearing loss, we want to make sure that you can still call and request your refill. If you have a hard time seeing small numbers on your phone, we want to make sure that you can still call your friends, your family, your neighbors to check on them, or for them to check on you. So that's our goal, is regardless of the type of difficulty you have, whether it's hearing, vision, mobility, memory, or speech, we want you to have a telephone that you can use on a regular basis.
Yes, absolutely. Especially right now, as you mentioned, with COVID-19 and the pandemic going on, and many other events that are happening, fires, PSPS, a lot of things that have been happening in this year 2020. So it is important to be able to stay connected, to be able to reach out to our neighbors, to reach out to our family members, to our doctors, to other services that we might need in case of an emergency. Now,
exactly.
yes. So I was fascinated when I learned about all the different devices that you offer. So we'll start with the first one, which is the specialized devices for people with difficulty hearing. Can you tell us a little bit more about that and how they work?
Sure. And let me just start off by giving you an example. My mom lives in the same town, but she's out in the country. And like most of us will do, we call our parents to check on them, right? Especially if they're elderly. And oftentimes she wasn't picking up her phone. And so there we go, rushing to her home to make sure she's okay. And then we find out that the problem is that she can't hear her phone ring because she has a hearing loss. And so for someone like my mom, our program has amplified telephones. Here's an example of one. So our telephones are going to ring much louder. So now my mom can hear her phone ring. And in addition, this one here has a flashing light. So it's going to catch her attention when it's ringing. And not only are our phones louder in regards to the ring, but the incoming voices can be up to 5 times louder than on a standard phone. And they have tone control, which is going to help with clarity. People that have a hearing loss not only struggle with volume, but with clarity as well. So our telephones are going to help you stay connected, and your conversations are going to be not just louder, but clearer.
Great, awesome. Yes, as we continue with working here at the Emergency Operations Center, especially with reaching out to our community, it's important to also keep in mind that we are such a diverse community that it's not only about race and ethnicity, but there's also a lot of people that we have with disabilities. So having these services definitely helps to reach out to all of our community and provide those services. Now, can you please talk to us a little bit about those specialized devices for people with difficulty moving?
Definitely. Our program has cordless phones. I'll show you one here. Here's a cordless phone that is going to help someone that has a hard time getting around. Maybe they use a cane, a walker, or a wheelchair. So having a cordless phone will be convenient because you can keep the handset next to you at all times. You're not having to rush to a telephone with the cord, so that you're not missing your phone calls. If you need to make a telephone call urgently, you've got your handset right next to you. So again, we've got the cordless phones, but there's another one. You'll notice this one doesn't even have a handset.
Oh, wow.
So this one is designed for someone that has more of a severe mobility difficulty. Maybe someone is paralyzed, they're bedridden, and they can still make and receive their own phone calls without having to rely on a handset. This telephone is remotely operated, so we match you up with some type of a device that you can use. Maybe all you can do is blow into a switch, and that would activate this telephone so that you can make and receive your own phone calls. So imagine how the quality of life of a person that is paralyzed would improve if you can just be independently making and receiving your own phone calls.
Yes, wow. I continue to be surprised with all the technology that we have. So now, speaking about other disabilities, what do we have to offer for people who have difficulty speaking? Do you have any devices for people?
Yes, for those that have a difficulty speaking, we have an array of devices and telephones. So let's say maybe you have a stuttering problem. We have anti-stuttering devices. And so that's a device that we teach you how to use. And it's a little complicated, but basically it reduces the stuttering to like 70 to 90%. So you're not stuttering as much. And then there's people that have an artificial larynx that we can provide them if they don't have a voice box. Then there's some people that just have a really soft voice for whatever reason. So we have a voice amplifier that we provide. And then some of our cordless phones will also, with the push of a button, will make your voice louder. So it just depends on what is going on with your speech. We have a variety of devices and telephones.
Amazing. Thank you so much for sharing those. And what about for people who have a difficulty learning or remembering? I know sometimes, now that we have cell phones, even myself, I tend to forget people's phone numbers. But I'm sure, for example, my mom, she only memorizes my sister and my phone number, but she doesn't remember anybody else's phone number. Do we have any devices?
We do, and you guys must be her favorites. So here's a telephone. And there might be a little bit of a glare, but if you'll notice, it's got the nice big numbers, but it also has a photo feature.
Oh, wow.
So you can insert pictures of people that you call often so that you don't have to remember their phone numbers anymore. All you have to do is pick up the handset and press the picture of the person you want to call.
This is more like a speed dial, almost, right?
Yes, it's a speed dial, but with pictures for people that have a hard time remembering. Because, if you think about it, maybe they just remember your face if they're getting to a point where their memory is really failing them. So with the push of a button, they can be calling you. And if those pictures are a little too small for someone, we have another device. It's called a photo dialer, and it holds wallet-sized pictures, so they'll be a lot easier to see.
Excellent. So for those phones, do we have to take the pictures and then put them in there, or perfect? That's like a perfect arts and crafts activity that we can do with our loved ones. I love it.
Exactly. That's
Yeah.
the fun part, is collecting the pictures.
Oh, wow. And so nowadays, I know, for example, going back to my mom, is there, she doesn't have a house phone. She has a cell phone. Do you have any accessories or any devices that can help her with having a cell phone?
Yes, we've come across that in the last few years, is that many people are getting rid of their landlines, either because they feel they don't need it anymore, or, maybe we're on a budget and it's either the landline or the cell phone, right? So for those that are only using landlines now, I'm going to go back to the cordless phone I showed you. This looks like a regular cordless phone for a landline, and it could be, but on the very bottom, it'll tell you that it's Bluetooth compatible.
Huh.
So that means that your mom can connect her cell phone to this one via Bluetooth, so that when she's at home and you call her, she can pick up her phone call on this piece, because maybe she left her cell phone in the bathroom somewhere or the bedroom. And so the cordless handset is going to ring when you're calling her on her cell phone. She can choose which one she picks up from, her cell phone or this one. And the benefit of picking up the call on this one is that it's going to be amplified if she needs that. And it just might be easier for her to dial on this one versus the cell phone too.
Yeah.
So that's one option. The other option, say she has her cell phone and has a hard time hearing, but she wants an amplifier when she's out and about, not just when she's at home. So this little handset here will ring when you call her cell phone, and she can pick up on this piece.
Wow. And it looks just like a cell phone, right? So people don't have to feel weird or out of place by picking up a huge device. So I'm glad that this has that look and feel of a natural cell phone.
Exactly.
Well, you guys offer a great variety of devices and support for our community. Thank you for that. Our community truly needs them. And now, do you offer all these services in other languages?
We do. I mentioned that we have an application that the doctor has to complete. I'm trying to figure out where I left it now. Here it is. So there's applications that we offer, because your doctor has to verify on the back section that you have one of those difficulties: hearing, vision, mobility, memory, or speech. And these applications are available in various languages: English, Spanish, Hmong, Vietnamese, Russian, and I think I'm forgetting a couple of other languages. But you can always call our contact center, and you can ask for an interpreter.
Excellent. Wow. Thank you so much for that. And earlier you mentioned a program. You were talking about the California Relay Service. Can you expand a little bit more about what that is?
Definitely. So when this program started over 40 years ago, the goal was to ensure that the deaf could communicate. The deaf needed a specialized equipment, a TTY or a teletypewriter, to communicate. And in order to communicate using the TTY, that user is typing what they want to say. But there has to be an operator voicing to their caller so that they can communicate with someone else that does not have a TTY. And so that operator assistance to facilitate those communications, that is the California Relay Service, and it's a completely free service that is available 24/7.
Amazing. Thank you so much. And tell us more about the speech-to-speech services that you offer.
So let's say someone has a hard time speaking clearly enough to be understood. And I'll give you an example as well. My brother-in-law was only 30 when he ended up having cancer in his tongue. And so he had to have part of his tongue removed to take care of that cancer. and he ended up with a speech impairment. And though he went to speech therapy, sometimes it was really difficult to understand him, especially over the phone. You know, in person we use hand gestures and body language, but over the phone it was quite challenging. And so had we known about this service, because this was before I started working for the program, had we known about speech to speech, he could have had a specially trained operator on the line with him so that he was able to communicate independently. So similar to the California Relay Service, speech to speech is a service that provides facilitation so that people with speech problems can communicate over the phone.
Great. Thank you so much for all the services that you offer. But just to summarize everything that we have covered today, so the services that you offer are free, and definitely people can reach out to you and to everybody else, to your program, to get more information about this. And also, the requirements are that they need to complete an application, and this application has to be signed by a doctor just to confirm that there is an impairment and the need of these devices. And then you have devices for difficulty hearing, difficulty moving, difficulty speaking, difficulty learning or remembering, and as well as speech-to-speech services that you offer. And you also have devices that can help any mobile devices users. Wow, so this is amazing, and this is great information for our community. And you who's watching us at home, if you don't need the information at this time, maybe you know somebody who can benefit from these services. So we do ask you to please spread the word and talk about the services as well. You don't have to memorize everything. You can just reference back to this video, and you can definitely connect somebody else to these services. And before we go, how can our community reach out to you? We have some phone numbers that we received ahead of time. So they're going to be coming out on your screen right now. And can you tell us a little bit more about how can people reach out to you in terms of like the times, the languages that they're offered, and if there's a different number for each region?
Of course. So we have various offices throughout the state, Northern California, Southern California. I'm in the Central Valley. We have an office in Fresno. So if you go onto our website, californiaphones.org, you will see a listing of the offices that we have. You can also call our 800 number to request an application, but you can also download it from our website. You can download the application from the website if you'd like to. Again, there's different phone numbers for different languages. So let's say you speak Spanish. You can call our Spanish line, and all those phone numbers will be listed on our website. I would also recommend that you call the 800 number before you visit one of our offices, just because, like you mentioned, there's been fires, the air quality has been pretty bad in some areas of the state. So we always recommend that you call before you visit, so that you know of any restrictions, any special attention that you might need to take in regards to masks, how many people are allowed, and our hours of operation as well.
Wonderful. Thank you so much for all of the services that you provide again. And thank you everybody for watching, and thank you for joining us. And so just remember that we're still in Binational Health Week. It's still October. We still have one more Friday coming up. And next Friday, we'll be talking about all of the great events that happen in the month of October. We will have the Mexican consulate here with us to talk about their events as well. So thank you everybody for watching. And thank you for continuing to keep your social distance, wearing your face coverings, and as well as washing your hands. And remember that outdoors is safer than indoors. We know that we're now in the orange tier, but we want to remind you that if we want to continue to keep our loved ones safe and our community safe, please take care of yourself. Take care of somebody else, and thank you for watching. We now have Facebook Lives on Wednesdays and Fridays. We have removed our Facebook Lives on Mondays. So please tune back on Wednesday for our English Facebook Live. Thank you, everybody.